Have you ever looked at your pill bottles and thought, is this my life forever? Blood pressure medicine, diabetes medicine, cholesterol medicine, maybe medication for reflux, joint pain, or another health condition. Then, at your next doctor's appointment, your healthcare provider tells you the three familiar things: lose some weight, eat healthier, and exercise. But what does that actually mean? Does losing weight guarantee that you will come off your medication? Or if your numbers improve, can you just stop taking the medicine altogether? Well, today we are going to have an honest conversation about what weight loss and healthier habits may change and why becoming medication free should not be the only definition of success. Hey, welcome to Weight Talk Thursdays. I'm Dr. Keisha Pickford, a nurse practitioner, a holistic nutrition weight loss coach, and a woman who is still navigating her own weight loss journey after losing more than 130 pounds. And here at Ample Health and Wellness, we look beyond the number on the scale. We talk about the food, habits, hormones, stress, sleep, medical conditions, and real life circumstances that influence your health, especially for women over 40. So let's start with the question you came for. Can weight loss help you come off medication? Well, the honest answer is possibly, but it depends. Weight loss can improve several health markers, including blood pressure, blood sugar, and cholesterol. Even modest weight loss may provide meaningful health benefits, especially when someone is overweight, is dealing with obesity, prediabetes, type 2 diabetes, or obesity-related high blood pressure. Now, that means some people may eventually need a lower medication dose or fewer medications, or in some circumstances, no medication for that particular condition. But notice that I said some people. I did not say everyone. Your medication needs depend on much more than your body weight. They may also depend on genetics, how long you've had the condition, your kidney and heart health, your family history, your age, and other medical conditions. And it can depend on whether any permanent organ or blood vessel changes have occurred. Two women can lose the same amount of weight and have completely different medication outcomes. Now, let's use high blood pressure as an example. Losing weight, improving nutrition, becoming more physically active, reducing excess sodium, sleeping better, and managing stress can all support healthier blood pressure. Even a relatively small amount of weight loss may help some people manage or prevent high blood pressure. But high blood pressure is not always caused by weight. A person can be physically active, eat a balanced diet, and still have hypertension because of genetics, kidney disease, hormonal factors, vascular changes, or other health concerns. So yes, your blood pressure medicine may eventually be reduced, but you may also continue needing it, and that does not mean you failed. It means the medication is helping control a condition that could otherwise damage your heart, your kidneys, brain, or blood vessels. Type 2 diabetes, well, that's another condition in which weight loss and stable or sustainable lifestyle changes can make a significant difference. Improved nutrition, physical activity, and weight management may lower your blood glucose and improve other cardiovascular risk factors. Current diabetes standards recommend comprehensive treatment that includes nutrition, physical activity, behavioral support, and individualized weight management goals. Some people with type 2 diabetes may need less medication as their weight and blood sugar improve, and some may even reach remission. But remission does not mean that diabetes never existed or can never return. It means blood glucose has remained below the diabetes range for a defined period without glucose lowering medication. And depending on the medication, your healthcare provider may want you to continue it because it offers benefits beyond lowering your blood sugar, such as protection for your heart or your kidneys. So, we do not judge the value of a medication based only on whether it lowers one laboratory number. We look at what the medication is doing for your whole health. Now, cholesterol. Cholesterol medication is where many people become frustrated. They say, I lost weight, I changed my diet. Why am I still taking cholesterol medicine? Well, because cholesterol is influenced by nutrition and weight, but it can also be heavily influenced by genetics, age, menopause, diabetes, liver function, and your overall cardiovascular risk. Lifestyle changes may improve your numbers, but they may not completely remove the need for medication. For someone who has already had a heart attack, a stroke, vascular disease, or very high cardiovascular risk, cholesterol medicine may still be recommended even when the current cholesterol level looks good. Sometimes the level looks good because the medication is working, and that distinction matters. Now, weight loss and improved metabolic health may also affect medications used for acid reflux, joint pain, sleep apnea related concerns, certain blood sugar complications, and some conditions associated with chronic inflammation. But again, improvement does not guarantee that every medication will disappear. There are also medications that may have little or nothing to do with your weight. You should never feel that needing medication means you did not work hard enough. I understand why people want to come off of medication. Medication can be expensive. It can have side effects. Taking several pills every day can make you feel as though your health is controlling your life. And after losing more than 130 pounds, I understand the hope that weight loss will fix everything. But one lesson from my own ongoing journey is that health is not always that simple. Weight loss can improve many things without making every diagnosis disappear. And sometimes we get so focused on saying, I want to get off all my medicine, that we overlook the progress already happening. Maybe your blood pressure is controlled. Maybe your A1C has improved. Maybe your medication dose is lower. Or maybe you avoided needing a second or third medication. Maybe your joints hurt less, or you move more comfortably, or your lab results are heading in the right direction. Those are real health victories. So let's do a quick myth or fact. Once my blood pressure or blood sugar becomes normal, I can stop my medication. Well, that's a myth. A normal reading may mean that your current treatment plan, medication, nutrition, physical activity, weight management, or a combination means it's working. Stopping medication suddenly can cause the condition to become uncontrolled again. And some medications also need to be gradually reduced rather than stopped abruptly. Medication reduction, sometimes called deprescribing, should be a planned and supervised process between the patient and the prescribing clinician. So please do not cut pills, do not skip doses, or stop a medication because you had one good reading. That one blood pressure reading or one blood sugar check does not show the whole pattern. You have to have a conversation with your clinician. And instead of asking only, can I stop my medication? Try asking, my health numbers have been improving. Is it time to review whether I still need this dose? Bring useful information with you, such as your home blood pressure readings, your blood sugar readings, when appropriate, recent lab results, symptoms such as dizziness or low readings, changes in your weight, changes in your eating and activity patterns, and an updated list of everything you take. That gives your clinician or healthcare provider more than one isolated number. It gives them a pattern. And medication decisions should be based on patterns, safety, and your complete health picture. Now, here is an ample perspective. The goal is not to prove that you are healthy by throwing away every pill bottle. The goal is to create the healthiest body and life possible for you. Sometimes that results in fewer medications. Sometimes it results in lower doses. Sometimes it means continuing medication while reducing your risk of complications. And sometimes the medication is one of the tools helping you remain healthy enough to build the life you want. Medication and healthy habits are not enemies. Nutrition, movement, sleep, stress management, medical treatment, and appropriate medication can all work together. You do not have to choose between being natural and receiving medical care. Holistic health means looking at the whole person, not rejecting every medical tool. So, can weight loss help you come off medication? It may, but the better question is, how is my overall health changing, and does my treatment still match what my body needs now? That is a conversation worth having with your healthcare provider. And please remember, needing medication is not a character flaw. It is not proof that you have failed. Your worth is not measured by the number of prescriptions in your medicine cabinet. If you feel like you have been told to just lose weight without anyone helping, you examine the patterns affecting your progress. My root cause weight loss wellness audit may be a helpful next step. We look at nutrition, sleep, stress, symptoms, habits, and other possible barriers so you can better understand the bigger picture and prepare for more productive conversations with your healthcare team. The information to this audit will be listed in the program's description. Well, that's all I have for this episode. I thank you for listening and taking time spending here with me today. Until next time, I need you to keep taking care of your whole health and your whole you. And remember that not just the number on the scale matters, the whole you matters. And also remember, be safe, be kind, and I will see you next time on this channel. Bye for now.